Hi, I'm Mary Green Brown, the Stroke Program Coordinator at SoutheastHEALTH. We all know the warning signs of a stroke: balance, eye or vision problems, facial droop, arm weakness, and slurred speech. We use the acronym Be Fast. I'm here to talk to you today about the last letter of that acronym, T. T stands for time. Time is critical for stroke patients. The sooner we start the assessment of the patient, the sooner we can deliver medications to help stop the stroke and the damage that it does. What you're about to see are two different scenarios of how a stroke victim seeks treatment. On your left, the couple is calling 911 for assistance, and on your right, they have elected to drive themselves to the emergency room without the assistance of an emergency response team. Let's first look at the couple who's elected not to call 911 and drive themselves to the emergency room.
Laura.
What? What
I can't see.
Oh my gosh. Oh my gosh. We need to go to the ER. Navigating traffic and taking care of the patient is a tall order for a spouse or loved one. Not only is this time consuming, it's dangerous because the patient could deteriorate en route to the hospital. Additionally, the hospital you may choose may not be equipped to care for stroke patients, further delaying stroke treatment.
An ambulance would have been easier.
No.
When 911 isn't called, stroke care doesn't start until the patient arrives at the hospital and stroke symptoms are reported.
Sorry. Just move. Go. I think my husband's having a stroke. I just brought him in the car.
All right, let me go grab a nurse real quick. Hold on.
Okay.
What's going on today?
He woke up and his arm is funny. He's rubbing his arm and his...
Now that the patient has finally arrived to the hospital, the ED team will quickly assess the patient and obtain information regarding his symptoms. Once it's determined that the patient is having stroke symptoms, the stroke team is activated and the patient is quickly taken for tests to determine treatment options, have labs drawn, get an IV started, and obtain a health history. As you will see in our next scenario, by calling 911, most of this will have already been done by EMS. Now let's look at scenario 2, calling 911 immediately at the first signs of a stroke.
Laura,
What?
I can't see. I think I'm having a stroke.
Oh my gosh. I'm going to call 911.
Yes.
911, what is your emergency?
I think my husband's having a stroke. His face is contorted. He's rubbing his arm.
Is he injured?
No.
Is he able to speak?
Yes.
Ma'am, I need you to stay with him and stay on the phone. I have dispatched an EMS crew to your location. Do not try to move him yourself.
Hello, sir.
Hello.
What's your name?
David Mees.
David, my name's Tim. What's going on today?
I'm having a stroke.
Yeah?
When you call 911, stroke care starts as soon as EMS arrives to you. EMS personnel quickly assess the patient to confirm stroke symptoms and time of symptom onset. They also obtain a health history and establish an IV. Most importantly, EMS will alert the hospital that a stroke patient is coming. The EMS responders communicate vital information to our emergency department so that the stroke response team can be activated prior to your arrival, thereby reducing time to treatment. Driving by car isn't recommended, as the patient could deteriorate en route. EMS have the ability to properly monitor and stabilize the patient during transport to the hospital. Additionally, EMS personnel know which hospitals are designated as stroke centers and can offer evidence-based stroke treatment. EMS pre-notification allows for a rapid transition of patient care and has been shown to decrease the time it takes to make a decision regarding stroke treatment. You will still receive prompt care when you arrive by personal transport. However, time to stroke treatment may be delayed because the ED staff will need to obtain information that they would have already received had you called 911. Stroke symptoms include sudden onset of confusion, eye or vision changes, weakness or numbness to your face, arms, or legs, trouble speaking, sudden balance issues, or sudden severe headache. Responding promptly to stroke symptoms is essential because the chances of survival and recovery are greater when emergency treatment is quickly received. Thanks for joining us today. And remember, please call 911 at the first sign of a stroke. Time loss is brain loss.